So they could not hear anything?
They couldn't hear anything.
But why did that happen?
She had it off, the line in off, but we're good now.
Okay. So sorry about that. This is growing pains of a live transmission. I'm going to start again. Low Carb Houston tomorrow starts at 9 o'clock. I want all of you to be there. And it's at the Biotheater. I expect about 400 to 450 people in that auditorium. I'm going to start the program with a transformational story. So a few days ago I sent out this tweet which said you don't need 28,000 patients to prove that something works. An individual's journey, in this case Dr. Ramon Issa, his journey back to health, it's something that is inspirational, mesmerizing. In a period of about 1 year, he lost about 100 pounds. Not through medications, not through surgery, but through nutrition and fasting. And he's going to share his story. It may not work for everyone, but his story will have some key pointers for you to learn from. These are the amazing before and after pictures of this handsome physician. I met him in Denver this year as well as a year ago, and I was honored and I was so moved by his story that I wanted him to share it in front of a larger audience at Low Carb Houston. Another before and after story. So I wanted to juxtapose this with what some of the physicians are going to come and tell you about the benefit of drugs. And one of the drugs that's going to be talked about, and since I want the audience to get a broad exposure, one of the drugs that's going to be talked about is the new drug that reduces LDL cholesterol. Now this is the PCSK9 inhibitor. Now what is PCSK9? PCSK9 is a molecule that our liver elaborates, and what it does, if you see on the slide, is that this PCSK9, where there is an arrow, it comes in, it attaches to the LDL receptor and removes the LDL receptor. So what the LDL receptor does is that it picks up an LDL molecule and removes it from circulation. So in other words, it reduces the LDL cholesterol. So as you can see in this animation, PCSK9 is removing the LDL receptor, and hence, since there is no LDL receptor available, the LDL cannot be picked up from the circulation, and large amounts of what is called the bad cholesterol remains in circulation. But there is a biologic role of LDL. LDL does something good which hardly any physician will talk to you about. What nature intended our LDL to do, which is a lipoprotein, which means that it is a molecule that carries cholesterol in our bloodstream. It is designed by biology to fight bacteria, fight infections, reduce inflammation levels, to repair our cells, to provide fat energy to our cells. So let's see what happens when we remove the LDL from circulation through a medication. So this next slide shows the action of the drug that is being touted as a wonder drug. So this wonder drug, which is called PCSK9, it goes and binds to the PCSK9 molecule. So this is the PCSK9 inhibitor. And as it binds to the PCSK9, it removes the PCSK9, and hence a lot of LDL receptors are present. They are not removed from the liver. What they do is they mop up the LDL, and when they mop up the LDL, very little LDL is left in circulation, and the biologic role of LDL in terms of infections, which is host defense against bacteria, cell repair, modulation of inflammation, go away. So what I want to tell you is that this molecule that was designed by nature to give us energy in the setting in which there was nutrient deficiency has happened as we evolved over time. In other words, we evolved in a nutrient depleted environment with unpredicted episodes of fasting. That's what our ancestors had to face. They did not have a supermarket and a fridge. And PCSK9 permitted people to have energy availability through lipoproteins. It also increases when you have an infection. When you have an infection, it increases the level of LDL. It lets you have infection fighting ability. It lets you have ability to dampen inflammation, to provide cell repair, to cause reverse cholesterol transport. So the makers of this drug, the PCSK9 inhibitor, did a clinical trial. Now I want to take you through the nuts and bolts of a clinical trial. How is a clinical trial done? So typically a large scale pharmaceutical run clinical trial is done at about 1,000 clinical sites in 25 countries. The big pharma pays the clinical site. It pays a team of experts that it hires to see how many events were there in the drug group and in the control group. It hires a safety group which monitors and sees if the drug is causing any harm or if it's causing any benefit. It hires statisticians to evaluate and analyze the data. So all these people are paid by the pharmaceutical industry. Now FDA is supposed to review this data objectively, but they're not that objective because a large portion of the FDA's budget comes from the pharmaceutical industry for new drug approval. Then once the study is done, it gets published in a medical journal, and you would expect that medical journals would be scientifically rigorous. But there is a conflict there also. Medical journals derive a large portion of their revenue from printing these articles because a number of reprints and advertising is done by big pharma. And finally, you would think that big academic associations like the American Heart, the American College of Cardiology should be very objective, but they are not, because a large portion of their budget also comes from the industry. And finally, you would think that a physician like me who is prescribing this drug should not have a conflict of interest, but the pharmaceutical companies come to people like me. They'll say, hey, Dr. Ali, you are a key opinion leader in your community. Why don't we pay you about $2,500 about 4 nights a month, and you go out and tell your community physicians that this drug is good. So the reason I pointed out to that slide is because there is a lack of checks and balances, because pharmaceutical industry has control over all aspects of a drug trial. Science suffers and the patient care suffers as a result of lack of checks and balances. So whenever you look at a clinical trial, you should look at it from a perspective of how it is conducted. So this slide shows a study of Repatha. This is a PCSK9 inhibitor that reduces the LDL level quite dramatically, as shown here in the red line. 28,000 patients were divided into 2 groups. 14,000 were given the drug. Their LDL level was 30 milligrams. Another 14,000 were not given the drug. Their LDL was about 90 milligrams per deciliter. At the end of the study, the number of people dying in both groups was the same, maybe a little higher in the treatment group. compared to the control group. So I wanted to put it in juxtaposition to Dr. Isa's story because that is so powerful. The effect is so powerful that it is tangible and can be seen in one individual. Now, if you need to take 28,000 patients, and despite taking 28,000 patients, you cannot show a robust difference in a major endpoint like death, then that means that the effect of the drug is so small that one has to question, is it worthwhile trying a therapy like that, especially when the magnitude of effect is small, when there are lacks of checks and balances in a clinical trial because it's run predominantly by pharmaceutical industry, when this drug has to be taken for 30 to 50 years, and there may be a number of side effects of these drugs because having a very low LDL is potentially detrimental from the standpoint of increasing the risks of infections, increasing the risk of becoming a diabetic, and perhaps not repairing your cells to injury as you were able to used to. And another important point is that the LDL carries fat-soluble vitamins. And it's possible that you can have vitamin deficiency that can be meaningful not in a short time frame, but over a prolonged time frame. So Low-Carb Houston is going to get into the weeds of this. It's going to give you information so that you can make important healthcare critical thinking decisions. It's not individual medical advice by any means, but it's going to point a lifestyle of low carb, of fasting, and I'm going to give you various nuances so that you can practice it better for your health. So I'm very excited, and I want everybody to come to the University of Houston Clear Lake Biotheater before 9 o'clock tomorrow. There are still about 50 seats left. So you have a chance. There are about 400 people registered for the conference. Thank you.